please pay attention here right now. Hear me loud, hear me roar. Your allergist ain't gonna know jack about this. What the hell or what the heck is mast cell activation, histamine intolerance, or allergies? And some people don't know what we're talking about. When you have an allergic reaction, whether it's to environmental, whether it's to food, it can activate what we call a histamine pathway. And so what I want to do is I actually want to share a screen and show you guys just so we have a common language with which to understand histamines. So I'm going to say that a lot of people think about allergies and they think about the allergist. And the allergists, most of them are there to really test you for what we call IgE allergies. And that typically is related to environment or food. And most people also think when they have allergic reactions that they think about just allergic reactions. So I kind of want to show you guys right here that when we're talking about food allergens, let's say from food, using food as an example, right there, you can see that there's food particles coming on receptors on these cells in our body called mast cells. And when the mast cell sees these food particles that it thinks it's foreign, doesn't belong there, doesn't like it, it then triggers what we call a release of histamines. Now, histamine pathway is, yes, associated with the top right upper corner with all of these symptoms, right? Where we think of ear, nose, and throat, mucus, asthma. Sometimes people will get gut-related diarrhea, upset stomach, hives, rash, right? A lot of people think instant allergic reactions like that. Well, histamine pathway is also associated with many other systems. Hi, I'm Maggie, UMD, and I'm a functional and holistic medicine physician and the creator of the Transform and Transform protocol. If you're interested in learning what are the root causes of all chronic disease, go ahead and click the link in the description where I have a power-packed 30-minute training that goes over what are the 5 pillars of Transform. Go ahead, click the link, and I'll see you in that training. So right here, look at cardiovascular. So how many of you guys, when you eat a food or you get exposed to a certain allergen, you get what we call cardiovascular symptoms, like your heart starts to racing, or you start noticing that your face flushes bright red, or your heart starts to beat irregularly, or your blood pressure really starts to change. How many of you have POTS? That's possible orthostatic tachycardia syndrome or dysautonomia type symptoms. But you notice when you eat certain foods, that's when the blood pressure switch happens. And that's when you feel like you need to faint. Well, there's a link between histamine and these cardiovascular type diagnoses or diseases that no one knows how to treat. Well, I'm just showing exactly what's causing that right now. If that's resonating with you, type that in chat. Someone said face flushing, right? Like POTS, right? POTS people, please pay attention here right now. Hear me loud, hear me roar. Huge part of POTS, postural orthostatic tachycardia syndrome, and dysautonomia, and a lot of people who have vertigo and dizziness, right? Or a lot of big blood pressure changes or heart racing, seemingly random, is as a result of these allergens that mediates a histamine release that goes to your cardiovascular, meaning blood vessel system. Now, your allergist ain't going to know jack about this.
Yes.
Okay?
It's so unfortunate too.
Don't deal with heart type symptoms or dizziness symptoms or POTS or dysautonomia, right? And your allergists don't deal with heart related type symptoms. So they're going to be sending each other back and forth to each other. And both of them are going to be like, I don't know what to do with that thing. I don't know what to do with that thing. Mm-hmm. And then looking at this histamine pathway, you also see that histamines can cause, yes, a lot of skin-related symptoms or diagnoses with redness, swelling, itching, hives, pain, but it can also be chronic type of rashes, lichen sclerosis, lichen planus, mediated by these elevated histamines. Even people with fungal infections on their skin can be as a result of a lot of these food allergens and histamines in their skin, making the environment on their skin more prone to fungal infections. And then look at, I can keep going. Do you guys like this? Is this helpful?
It's so helpful because no other doctor is connecting all of these dots. It's like you say, you go to an allergist, but they're not telling you any of this stuff. They're certainly not getting into anything cardiovascular beyond what you're talking about. Nope, not at all. So please continue.
And this Facebook user, I don't know what diagnosis this person's been dealing with, but basically it's going the merry-go-round between the allergist and the and the heart doctor, maybe even the skin doctor. And then let's go to inflammation pathway. Right here on this section with the inflammation pathway. Histamine causes swelling not just your blood vessels, but of your muscles and your joints. So, how many of you notice that when you have a reaction, it isn't just a standard allergy, you're having these pain flares in association with certain exposures to certain foods? Well, then people are like, who do you go to? You go to the orthopedist who says that you don't have a broken bone, your MRI is fine, you're cuckoo for Cocoa Puffs, let's put you on some antidepressants. Or
Mhm.
let's send you to the neurologist or the psychiatrist, right? So there is a histamine related pathway that triggers inflammation that causes joint, muscle, and even nerve pain, neuropathy. How many of you have neuropathy and nerve pain out there and you know it's related with your food?
Mhm.
Uh-huh. It's because of the histamine pathway. I'm just letting you know right now.
That
So
person's in pain every day.
yeah, it's related with these food particles, mast cells, histamines. And then not to even mention, look at central nervous system here on this corner here. So guess what? Histamines can change the neurotransmitters, which are the hormones in your brain required for focus, required for your mood. So with ADD, ADHD, depression, anxiety, right? Did you know that these histamine pathways can cause mood disorders or inability to focus and even dementia?
Dementia. I mean, that's not ever discussed.
Correct. And finally, we have two other pathways. Uterus here is really signifying that we already have data, scientific research papers that actually shows that histamine can alter the amount of estrogen circulating in the uterus, so causing painful periods. So, did you know histamine pathway can interfere and interrupt with your hormonal production and breakdown pathways, worsening hormonal imbalance?
This really sounds to me, Dr. Maggie, like it can touch every aspect of your body.
Well, yes, and even kill you with cancer. Look at the cancer pathways right there. So, chronic food allergens, chronic histamine release, mast cell overproduction of these, trouble with breaking down histamines. These disorders all can increase the risk of certain cancers. Hi, and thank you for watching this video. If you're interested in actively looking for a solution to your problem and you'd like to work with us, I'm going to invite you to go ahead and click the link in the description to book a chat with our team. What that's going to do is it's going to bring you to a calendar, pick a time that's going to suit your needs best. It's going to be about a 15-minute phone call. After you book that call, there's going to be a link to a short questionnaire. And that's really important for you to fill out because it's for us to get to know you better and helps us to better prepare to make the most of our time together. After you fill out the short application, it's going to take you to a page where there's a couple resources. What I want you to do is go ahead and click two of those and watch those two trainings. They're going to really best prepare you for your phone call with us to make the best use of our time together. I and my team look forward to talking to you to learn more about you, to see if we are indeed a good fit to work together. Thank you.